I'm super excited for this episode today. My name is Laura Deneen. I'm one of your hosts. Our other co-host, Lauren Jackson, is not with us today, but she is with us in spirit. I am super excited for today's episode. I think it will be really valuable for you all. And so, if you're new to the show, welcome, welcome. We're about two things on this podcast. First and foremost, we are humans living life with you all. And so Lauren and I talk a lot about some of the struggles and pain that we have been through. And then secondly, we also are therapists. And so we have the amazing privilege of sitting with clients. We really cherish the work that we do. And so this platform has given us a wonderful opportunity to share some of the things that we've learned over the years as clinicians. So we're super grateful to have you all. Just a quick disclaimer, this is not meant to be your therapy. If you are in the state of Tennessee, we would love to work with you. And if not, we encourage you to find someone local to you. So without further ado, I am here to welcome Dr. Elise Scott. Welcome to the show today.
Thank you.
Yeah.
So I was excited and honored to be here.
Yeah, same. I was thinking about who I wanted to have on the show, and Elise, you just came to mind. I have so enjoyed collaborating with you and sharing clients with you and just learning from you. And so I'm really excited for our listeners to learn from you as well today. We are going to be talking about debunking some of the myths associated with psychiatry. Some people in the clinical space refer to it as medication management. So Dr. Scott is an amazing psychiatrist. She's been through medical school. She can share a little bit more about her training, but I thought that this would be a really valuable episode. I do think that there are quite a few myths associated with the world of psychiatry and medication for mental health. So welcome.
What do you mean? Everyone just totally understands it and have, There's no reason that anyone is afraid of psychiatrists. I would love to try to debunk some of those myths. And I will also give the disclaimer that I certainly don't represent all of psychiatry or all psychiatrists. I have a very, I would say I have probably a very therapeutic style and a very therapeutic bend to the work that I do. And so you can always find people who probably disagree with me, but I have pretty strong opinions and I'm willing to share them.
Yeah, I love it. Well, and I love just even your humor that you interjected just now on the show. I think it lends itself towards such a relational approach. So maybe this is myth number one that you go to a psychiatrist and you lay on the couch and the psychiatrist comes in with a white coat and is super buttoned up, because here you are using humor in the first 5 minutes of the show. And I just think that is such a beautiful thing because it's most likely how you show up in your sessions with your clients too.
Oh, for sure. One of my favorite quotes, I don't think it's a quote, I don't know, but one of my favorite sort of ways to approach the world is this idea of not taking ourselves too seriously. It's very important to me. It's something that I really try to embody and also remind my patients is we got to just breathe and laugh and embrace the absurdity of this stuff sometimes. And the fact that if we take everything really, really seriously, then we're kind of doing a disservice to ourselves and to everyone, just let's just be present with each other and let's just connect. And I think that's ultimately how I ended up here as a psychiatrist. I mean, most days, I have this thought of oh my gosh, I feel like I have the best job in the world. I feel so lucky to be able to do what I do. And that's not to say that I would ever go through the training process again, because I totally wouldn't now that I've been through it. But now that I'm on this side of it, I feel so honored to be able to sit in a space with someone else and hear their story and help them make sense of it and find meaning and purpose and a way through the hard times so that they can get to the good times too. And I really like to kind of circle back. I feel so much of that comes down to recognizing what you said, which is that we're all just humans and no one should be taken too seriously in any of this. We're just trying to figure it out together. And I love having the opportunity to sit with people and figure that out.
Yeah, it's very evident just in the way you talk and your body language. I mean, I can just tell how much you care about your work. And Lauren and I talk about this quite frequently on the show. It's like difficult calling it a job for us. I mean, there are definitely like hard days, but it's like so much more than that. You know, it's like sacred. It's so fulfilling. And yeah, like you said, being able to sit with someone in their story and in their pain and connect and, you know, instill some hope. I think we talk a lot about hope on this show. And I think that's a lot of both your work and my work. So yeah, I'm here for all of this. I'm curious. Okay, so we debunked one myth, right? That like your psychiatrist is going to come in with like
be approachable.
Yes. Okay. So psychiatry can be approachable. What are other, I don't know, myths that you've heard in your line of work around the world of psychiatry?
Yeah. Okay. So I think one really big myth that a lot of people come into at least medication management with is the belief that medicines are changing who they are. Right? Like that if I take this medicine, it could alter my brain in a way that is ultimately going to change who I am or like be permanent in some way. And so that's one of my favorite things about my job is just like being able to sit down with someone and explain to them what we know about how medicines work and what they can do. And I mean, there's variability. There's lots of types of medicines out there. But at the end of the day, most of the medications that we use in psychiatry are ultimately helping to increase neuroplasticity. Neuroplasticity being your brain's ability to be flexible again. And so if we go through something really traumatic, and we see this all the way down to the level of like fish, this is real, like this is evolutionary biology. When we experience over and over and over again, we get let down, like hard, bad, awful things happen. Our brains are wired to say, I am not gonna try anymore. I'm gonna shut down all those pathways. I am going to hibernate and I'm gonna protect myself because I've tried being hopeful. I've tried these things and it just sets me up to get burned again. And so whether it's trauma or depression or, you know, like anxiety, like so many of these mental illnesses or what we call mental illnesses that we treat are really like a result of our brain trying to protect us from being disappointed again. And so what happens is our brain starts to get really, really small and it just starts to shut down a willingness to go in different directions, to be open-minded, to have these different thought processes because we're trying to protect ourselves. And most of the medicines in psychiatry actually just help to reverse that process. They help to tell your brain, okay, I know you're scared. I know you want to hibernate right now, but you're not in the same environment you were before. Like things have changed and you really can't recover from trauma and depression if you don't open your mind back up to being present in the world and being able to form new networks. And so what these medicines do is they really just take that Play-Doh that's turned to clay and they turn it back to Play-Doh, or they take that highway where every single exit ramp has just been blocked off and they just open up the exit ramps. But it's ultimately you that's driving down those exits. It's you that's working through therapy to like, you know, chisel a different path for yourself. And the medicine is just helping prevent your brain from blocking you from being able to do that work.
Gosh, I love all of this. There's so much compassion that I hear when you're talking to of like, just even that analogy that you used around like the clay back to Play-Doh or the highway system. And I think it's an invitation to really look at the narratives that we've told ourselves of like, this is my fault versus, you know what, like this is actually protective for me and it's kept me alive, but maybe it's not working for me anymore.
Yeah, absolutely. And I think it really, like when people hear that explanation, it's so freeing, right? To be like, wait, it's not that I'm not trying hard enough in therapy. It's that I'm literally like trying to drive over a roadblock, you know, like it's just, and, you know, and that it's our brain, but it's not like you're not doing anything wrong. It's not anything broken about you. It's actually something that makes a lot of sense if you go back, and you look at these times in your life where it was protective to be able to shut down and not put yourself out in the world again. It just, our brains kind of go overboard. And everyone exists on a spectrum with this. So there are people in the world who are born with like a genetic predisposition for depression and anxiety, for their brains to shut down very easily. And some of those people really benefit from being on medicine for their entire life, because no matter what we do, no matter what work they do, life is traumatic, bad things happen, and their brain just wants to go back to that space, no matter what. And then there's people right around the corner, their next door neighbor, who could go through 1,000 horrific traumas, and their brain just isn't built that way. And somehow their brain doesn't do that, right? Just because they're a different human and they came in with different genetics. And we can compare ourselves and be like, why the heck am I so, vulnerable or sensitive or whatever this is? But it's just like, it's a combination of how you were born and what happened to you when you were young. And some people just are really, really vulnerable to it. And these medicines help keep them in a state that they can move past the hard things that happen in life.
Yeah, I think that comparison is really prevalent in my work as I'm, potentially making the referral to you. Just like, why do I need these medications and my mom doesn't, or my friend doesn't, or whoever it might be? I think that's really, really prevalent. And so this is where, like, as a therapist, I'm like exploring that with a client, like even that comparison in and of itself. I'm asking them to talk to you about that so that they can get the appropriate psychoeducation around what these medications do. And like, even like you said, like sometimes life is harder. I think some of us move through the world a little bit more sensitive to traumas and to hard things that happen and soak that in a little bit more than like the neighbor down the road, like you were talking about.
Yeah.
So, and it's not good or bad or right or wrong. It just kind of is. It's that epigenetic piece that we like literally can't control.
Yeah.
You mentioned one myth too in what you were sharing, so that I want to circle back around to that I see all the time. So I do see, is medication going to change me? Is it going to change my brain? I also see clients that are committed to therapy and maybe have never had a psychiatrist or never had maybe effective medication management. They'll say something like, is medication like doing the work for me? So say, the kind of the what if I come off medication and I revert back to exactly how things were before. And so, of course, I'll encourage them to talk to you about that question that they have. And we're also like debunking some of that in therapy. Like, no, like, let's be very clear. Like, you still have to take the steps and practice the skills. And in my opinion, as a therapist, like, I do think that you seeing somebody like Dr. Scott would be helpful for you so that you can actually even start to practice the skills. But that's a myth that I see quite frequently in my office as well.
Yeah. I love that you brought that up. And that's a tricky one, but I'll tell you my take on it. So every single time I start a medicine in someone, because there's people on the other side too, who are like, I don't want to do therapy. I only want medicine, right? Like, I just want the easy way out. It feels like the easy way out. And what I say to them is I say, this medicine is not going to work if you just sit in your bed, right? If we open up the exits on the highway, but you don't take them, it's not going to do a damn thing. It's just going to like all it's going to do is it creates potential, but you have to be the one to do it. So if somebody starts taking medicine and they're getting better, then that tells me that they are doing the work, and that work might look different for everyone. For some people, that work means intensive psychotherapy for years. For other people, they just needed a small little nudge in the right direction, and they already had the skills. They just weren't in a place where they could utilize them. And maybe they had done therapy before, or maybe they just were raised in a way that they learned these things that really were enough that medication alone was able to help them just be in a place to use them. So everyone that gets better on medicine, it's not through laziness. It's through the fact that they're actually having to take those pathways. And so that's kind of my biggest debunk of that is like, if you get better, you are doing the work. And so you deserve to give yourself credit for that, whatever that work looks like.
Yeah. We are so quick to like minimize, or a lot of us are so quick to minimize our accomplishments, or have, maybe have difficulty highlighting our strengths. And so this is like that strengths-based approach of like, hey, let's highlight what you are doing, the work that you are, engaging in to feel better, to get better. Yeah. I love that.
Yeah. I think another big barrier that people feel that's related to this is the idea of, I don't want to be dependent on something for the rest of my life, Yeah. And I think there's different ways to look at this. But what I always say about that is, well, you can always stop the medicine. And when you stop that medicine, you are going to be the exact, like, you are not going to be any different than you were before you started it, other than the fact that you knew what was possible, right? Like, that can change you, right? And like the process you go through. But you're not developing an addiction to this medicine. This medicine it's temporarily changing your brain to make it more available to heal. And at any point in your life, if you choose to stop it, or, for some people, their brain will go back to that state of being really rigid. Like, it will go back to clay. It might. Some people, it doesn't, and we can't always predict what that's going to be. Some of us can predict it for ourselves because we just know, like, man, I've been there, done that. But ultimately, you're not any more dependent on that medicine than you were before you started it. You just have seen what can happen if you allow your brain to like truly utilize its full self and not be in this state of fear where it has shut itself down.
Yeah.
And I think another thing that really scares people is the reason they feel dependent on a medicine is because if they like miss a dose, or they hear stories of a friend who had horrible side effects because they stopped it. And I'll say that a lot of times that's just because they stopped it too rapidly, right? Our brains are expecting this input. And if you all of a sudden don't give it to you, like what you experienced that day, that's not who you are without the medicine. That's just your brain trying to communicate to you, hey, I'm looking for this thing that you've been helping me out with, and it's not there. But I haven't run into a patient where I wasn't able to, if we just did it slowly and thoughtfully, that wanted to come off of medicine, where we weren't very able to do that. And the longer you've been on it, the harder it is. But most of the time it's because they stopped it too abruptly. And then I would say on the other end of things, like if they had a bad experience starting it, a lot of times it's because it was started too rapidly or too high a dose, and their body just like wasn't prepared.
Yeah. 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 And generally speaking, obviously, caveat here that this is not therapy. I'm not giving, recommendations to our listeners today, but generally speaking, I will discourage clients from like reading forums online or talking to friends about medication, because that's not an informed discussion. Oftentimes it's driven by our own anxiety or fears, and it's not super helpful, right? Versus like talking to a provider like yourself that has like literally been through medical school and, knows all the ins and outs and can get a thorough biopsychosocial background on them, or even lab work. And so, yeah, I do think that can cause even more barriers when clients come in and they're like, yeah, I've Googled this and this is what this person across the world says about this medication. Like, that is not super helpful oftentimes too.
Yeah. And you should remember that everyone's brain is different. And, at least I have a lot of experience and a lot of training to try to figure out and anticipate, okay, how is your brain going to respond? And it's going to be really different. We don't always get it right on the first try, but it's really helpful to go through the process with somebody who kind of has a sense of what's happening and can sort of help you navigate that, and also understand what you're experiencing in your body.
Just another barrier that's coming to mind is like what I will hear with clients oftentimes if I'm, making a referral to you or psychiatry as a whole. They will say things like, I'm so weak because I have to take medication, or I failed at therapy, which I know we've already alluded to some of like debunking some of these myths, but I was just curious, like, if you can maybe speak to those myths and how you would respond to that.
I would respond and be like, how? Right?
Yeah.
What makes this, like, do you say that to your spouse who's on an antihypertensive medicine because they have high blood pressure? Do you say that, like, to someone, like, would you say that to yourself because you were like any other illness or medical condition that we treat? Why do we treat this any differently? It's the biology of our brain trying to help us and being wrong, right? Which happens all the time. Like most medical conditions out there, right? Like you wouldn't blame yourself for developing cancer, but it happens through the same process that depression or anxiety or PTSD develops. Is it's literally our body just like doing its best to survive and then doing something that ultimately is detrimental to us. And who are we to judge what treatment is like weak or not weak? It sucks that the history of mental health, that there was this dualism, right? That we separated mind and body as if these were two totally separate things. And we still do this as a culture. We like separate anything that is cognitive from physical, but ultimately it's your brain, right? And that's scary and weird. And like you start to think about it too hard and you're like, wait, everything, like the essence of who I am, like all of this, like how is this also an organ in my body, right? And like how do I think objectively? And it gets really messy. And that's why it's hard. And I think that's why there's so much stigma. Like I understand the history of it, but we're at a point now that we realize, wait a minute, like at the end of the day, like, everything that's happening in our body is coming from our brains. Even for those patients I work with who, for example, have extreme somatic experience of stress, right? And maybe it doesn't manifest in like traditional anxiety, but maybe they struggle with like chronic pain, or they struggle with IBS, or they struggle with, these other ways in which our body carries stress and communicates to us like, I'm not okay. And we judge ourselves as if you have control over that. Like your brain is sending that signal, like, we can't control a thought that passes through our brain any more than we can control what our blood pressure is.
Yeah. There's a lot of, I think, stigma, a lot of, I think, work that we can do both in your office and in mine around like, hey, where did you learn this? Has this been something that has been, shared with you or, told to you, or where is this belief coming from? And like you said, like, is this something that you want to continue holding on to? Is this helping you? Is this serving you? And most likely the answer is going to be no, because a lot of times at the end of the day in my office, I find that we want relief. When we're in pain, we want relief. And so if we can work through some of this shame and some of this stigma that might be there, I think that, that's one way that we can start to find relief is through medication management.
Yeah. And it doesn't even have to be medication management. Like I say this to people all the time. You're here just to like have a consultation and learn a little bit more about what is happening in your brain and what the options are that are available to you. Know what's out there. And I never want people to feel pressured, because that's a personal choice for every single person. And even though I literally do this for a living, I mean, I have experienced that same thought in myself, right? Of like, man, like I, when I've been faced with like using medicine, to help myself through my own mental health, like judging myself, right? Or saying like, oh, like, I get it. It's built into who we are, and it takes a lot of work and a lot of objectivity to be able to see it any differently. And so I never, ever want someone to feel bad for feeling that way. I just want to help them see it a different way. And it comes down to that, classic dialectic in what we do, right? That just because we're responsible for doing something about it doesn't mean it's our fault. But we equate those together. We do it every time we think about it. And ultimately we just have to remember, just because we're in control and just because like our behavior is our own responsibility doesn't mean it's our fault.
Absolutely. And I love what you shared, right? And this is something that I will, just discuss with clients if I do think that they could benefit from seeing a psychiatrist is like, hey, let's have a consultation just so you know what your options are. And I think there's so much agency in that, especially if clients struggle with agency or struggle with like feeling empowered. Maybe you go see Dr. Scott and you choose not to take the medication, but at least you have the information. And so I do love that approach that you're taking of like, hey, I really want to empower and equip my clients to make the best decisions for themselves versus like you writing them a script and then like having to take it. Like you're doing so much like empowerment work here too of like, hey, what do you think? What's important to you? What is the quality of life that you want to live? And are you there or not? And if you're not, let's talk about it.
Yeah, absolutely. And sometimes I don't recommend medicine. I'm like, hey, I don't really think this is going to help, or this is what it could do. These are the limits.
Yeah, absolutely. I know we've talked about 5 or 6 here. Any other big myths that you see in your office?
So I'll talk about this one and we can include it if you think that it's powerful. But I think there's a really big fear that medicine is going to cause suicidality. And I see this like among like tons of people in the field, right? Like there is this belief that like, okay, these medicines are really dangerous and I might start it and I would like be at risk of killing myself. And so I want to bring that one up because that data was largely misinterpreted. And the reality is that some of the medicines that we use to treat anxiety and depression activate us when we start them. And so activation just means that maybe you were super, super depressed before, and all of a sudden, we just talked about this, right? We're opening pathways in the brain that have been closed for a while. And that can feel like that can be stimulating. That can increase all of our thoughts in general. And it might mean that you have more thoughts across the board. You might even have more thoughts that are suicidal in nature. But what we know is that there's never been an increase in intent or committed suicide from these medicines. It's that you're taking someone who is depressed and you're helping them have other thoughts. And of course, they're going to have thoughts that are related to their depression. They're having suicidal thoughts because they're depressed. They're not having suicidal thoughts because of some brain altering substance that's making them think outside of themselves. And there's something that can be like really healing about that too. So I really try to not scare people about that. I say, like when you start this medicine, you could start having a lot of thoughts you haven't had in a while, right? Or those thoughts might be different. Those thoughts might be suicidal, and we should definitely take that seriously, but we also shouldn't be afraid of it. Because just because you have a suicidal thought doesn't mean you're going to act on it or anything bad is going to happen. And when we look at the data and the literature, it didn't. People didn't try to hurt themselves. They just had more of those thoughts. And we really panicked and like freaked out as a society as a result of that. And I think it really does a disservice because after that information came out, the rates of use of antidepressants dropped significantly and the number of suicide deaths went up dramatically. And so we're trying to save people. And yet it's like, we really aren't weighing the greater good with this. And so I really that's another myth I really try to debunk with people to say that like, you're still in control of your behavior, this is not something that we have to be terrified of. Yes, I'm so glad I'm here with you for it. And yes, that's terrifying, but we're going to learn to trust you and we're going to get through this. And this is just a short-term thing that we see because we're like letting your brain wake up again after it's been in hibernation for a long time.
Like I'm learning from you today too. So thank you for your wisdom. I mean, this makes a lot of sense. And we talk to clients a lot about this, whether it's suicidality or other types of intrusive thoughts, right? Like our thoughts tend to be automatic and how we respond to them is very different than the content of the thought itself. And so I love that you're giving education around that to your patients, along with like taking it seriously. Like, yeah, let's talk about it. Let's figure out a game plan. Let's maybe pivot if we need to. But that's the benefit of having someone like you in their corner. So I'm really glad that you addressed that myth too. That makes a lot of sense to me.
the final thing that I want to say as it relates to myth busting is one that's like very near and dear to my heart. But I am, like I love to see everything, but one of my favorite things to do is women's mental health and reproductive psychiatry. And the reason why is because there are more myths and there's more misinformation out there in the world of women who are trying to conceive, who are pregnant, who are postpartum. There's so much fear and stigma and shame and guilt around mental illness during that time of our lives. And it breaks my heart. It is heartbreaking to see like what we as a culture believe when it comes to treating women during that period of their life, of like, there's just so much misinformation out there. And so if I could be on my soapbox for even 1 minute, it would be to just like really encourage any woman in that time of their life, or who's going through that experience, or who might feel some of that, to see a reproductive psychiatrist, to see someone who really does this work and knows the reality of it, because there's so much societal pressure to not be on treatment if you're trying to conceive, if you're pregnant, if you're breastfeeding. And it's just so inconsistent with what we know, which is that a healthy mom equals a healthy baby, and that not treating women leads to very poor outcomes for babies, but treating women is super safe and like leads to great outcomes. And like, if I like, there's a stronger reason to treat because you're pregnant, and I hate that it's taken us so long and that we're so behind in helping spread this information. But I just want to share that, because I think that a lot of people are in pain and confused and just misinformed.
Yeah. I'm just curious, like, what is some of the misinformation out there about treating women?
I would say that a lot of doctors, including psychiatrists, tell women that they need to come off of medicines in order to get pregnant or while they're pregnant. Medicines that we know are incredibly safe in pregnancy and that actually are protective from transmission of stress, like in utero. And it's devastating. And there's few things in the world as hard as like carrying a human and then having to go through that while also not treating, and we do this with other medicines too, but we don't even think twice about it. We have more safety data on psychiatric medications in pregnancy than any medicine out there. And it's just because of stigma. It's because people look at the drug and they don't account for any of these other factors, right? Which is that like, yeah, the person on that medicine was depressed. That's why their baby had these outcomes, right? But actually, if we treat that depression or we treat that anxiety, they have way better outcomes, way better growth, way better bonding, like everything. They're very skewed. And it's just because we went in looking for a certain answer and not accounting for like, well, what are the risks of not treating during pregnancy? What are the risks to that mom, and how does that get transferred to, the baby inside of her?
Yeah, that makes a lot of sense. And, having, had my daughter, she's 2 now, I have such a deeper level of like compassion and empathy for women who are either trying to conceive or have had babies after some of my own experiences that I went through when I was pregnant and postpartum. It's such a vulnerable time. And especially if you have someone in a position of power, right? So a doctor, a psychiatrist telling you like, hey, you need to come off these medications. And I think a lot of people just kind of accept that because they must know. And so I love that you are debunking that myth. And I think there's a lot of value in providing like more accurate information that is actually like going to help women that are in pain, because when we are suffering like with something that's maybe untreated, like we're in pain. And so I love what you just shared.
Absolutely.
Yeah. This has been a delightful conversation. Thank you so much for coming on today.
Yeah. Thank you for listening to me just go off with all my passionate beliefs.
I love it. That was actually the word that came to mind. It's passion. It's a good thing. I love it. Of course. Do you want to leave our listeners with either an affirmation or homework today?
Ooh. I think if I would leave you with any homework from today, it would be to just ask yourself, like, what beliefs am I carrying as it relates to psychiatry, as it relates to medication management, and just like my body and my mental health? Like, what beliefs do I carry and how true are they really? Like what stigma might be built in there for whatever reason, from society, from how you were brought up, and just kind of ask yourself what that is and whether there's really any evidence for it. Because I have a feeling that most of us, all of us, are carrying something. Even if we have to challenge it every day, we carry it. And so I think the first step is just noticing it and then asking yourself, okay, now that I've noticed this, is there anything I would change about my life? Is there anything I want to do differently? Yeah, that's what I would leave you with.
I love it. I love it. And, an affirmation that's coming to mind is really just like, I am capable of caring for myself, right? With medication management. For those of you listening, if you're already taking meds or maybe you're thinking about taking meds or even having a consultation with a psychiatrist, this is really just an encouragement that can be part of your self-care plan.
Yeah, absolutely.
Yeah. Yeah. How can our listeners find you?
So yeah, I'm online. I have a website, elisescottmd.com. If you go there, you can find my email address, you can find a text number, you can really reach out to me anytime. And yes, I have boundaries because we all should have them. So I'm not going to respond all the time, but I'm very accessible and I love meeting people. I love having these conversations and being challenged. So if you are just interested in connecting, please reach out. Or if you're interested in a consultation or seeing me, that's how you would find me too.
I love it. And y'all, I just cannot, speak highly enough of Elise. I have been so impressed collaborating with her, with shared clients, and just getting to know her more. And the quality of work that she does is just amazing. And so you all would be so lucky to work with her. So yeah, thanks for your time today and for coming on the Becoming Anchored show.
Thank you for having me. I'm so honored.
Of course. See you next time. Take care, guys.
Bye.
Bye.